In myelodysplasia, there is bone marrow failure.
It was in 2004. They did a bone marrow biopsy, and that's when I was diagnosed as having MDS.
Clara is a poster child for the population of MDS patients that I treat in my practice.
They explained to me, and they said, "Clara, I'm afraid there's no cure. Your life will depend on blood transfusions."
The majority of patients with myelodysplasia end up on red cell transfusions. A major consequence of that is iron overload. The body has no good way of getting rid of iron, and with time, iron will build up in important organs and eventually shorten life. In order to prevent that, you need to chelate iron from the body, and there are two available iron chelators in Canada. Desferal is a chelator that's given as an injection, either in the vein or under the skin.
Desferal is a very painful procedure. Is to have it 5 days a week, 12 hours per day. I could hardly sleep at night. They were switching me from one arm to another. Then it got to a point there was no place. I had all these blisters and whatever. And they switched the needles onto my stomach, and I couldn't even bend to put my boots.
Desferal is very uncomfortable for patients. It leaves huge welts under the skin, sometimes skin infections. That often leads to patients needing central lines that get infected, that can be life-threatening. And not surprisingly, compliance with Desferal is very poor. And poor compliance correlates with inferior survival.
It was so painful. Sometimes I thought, oh, you know what, just pull this out and forget about it and end my life. But I couldn't do it.
ExJade is an oral chelator. It's a tablet that you pop into a liquid and drink that accomplishes the same thing.
So she put me on to the ExJade, and I would never trade ExJade for anything in my life.
ExJade, hands down, is a better drug to prescribe as a clinician and a better drug to receive as a patient.
When people look at me, even my friends, they say it's really difficult to even think that I'm ill.
As it stands right now, without private health insurance, as a patient, you cannot receive ExJade, but you can receive Desferal.
Normally, if I had seen people having Desferal, I'd say, what is the big deal about having the needle in the arm? But I, as a patient, have experienced that, and I know how painful it is, how time-consuming it was. Unless you're a patient and you go through what patients have gone through with MDS, thalassemia, sickle cell, anemia, then only you realize how important it is to get funded for ExJade.
I hope this story has helped you understand why we're urging the Government of Ontario to fund ExJade for myelodysplastic syndrome patients in Ontario. My name is Chris Meyer, and I'm with the Aplastic Anemia and Myelodysplasia Association of Canada. We're asking for your help. Please contact your local MPP or visit our website to learn more.